Good morning, everybody. I am Dr. Rahul, working as a senior resident in the Department of Emergency Medicine. In previous session, we had discussed about basics of 2D echocardiography. So today we will talk about abnormal finding of 2D echocardiography, that is pericardial effusion. So I would like to start today's discussion with a case scenario. 35 years old male patient, known case of CKD, on maintenance hemodialysis, presented with the complaints of chest pain since 3 days and shortness of breath since 1 day. So after initial evaluation, we have done 2D echocardiography, and these are the findings of 2D echocardiography. So approach is always same, whether heart is beating or not, regional wall motion abnormality present or not, fluid around the heart present or not, chambers are dilated or not, and how is the contractility of the heart. So in this view, you can see unechoic structure around the heart, that is fluid around the heart. So this is pericardial effusion. So this is subcostal four chamber view. In this view, you can see some unechoic structure around the heart, that is pericardial effusion. So this is parasternal short axis view. In this view, you can see left ventricle, then interventricular septum, and this is right ventricle. And also you can see some unechoic structure around the heart, that is pericardial effusion. So this is parasternal long axis view. In this view, you can see left atrium, left ventricle, aorta, and right ventricle. And this is descending thoracic aorta. So sometimes we will get confused between pleural effusion and pericardial effusion. So this view is best to differentiate between them. You can see some unechoic structure above the descending thoracic aorta as well as below the descending thoracic aorta. So above the descending thoracic aorta, that is pericardial effusion, and below the descending thoracic aorta, that is pleural effusion. Pericardial fluid most commonly appears as a black stripe around the heart. Fluid seen just in a systole, a small effusion, probably it is physiological, and fluid also seen in diastole, likely to be a pathological effusion, but still may be too small to cause symptoms. And heart rocking within large effusion, maybe patient required immediate pericardiocentesis. And right ventricular diastolic collapse plus IVC distended, it's suggestive of cardiac tamponade, and it is clinical diagnosis. And sometimes you will get false positive pericardial effusion and false negative. So in pleural effusion and anterior fat pack, you will get false positive, and in loculated pericardial effusion, you will get false negative. So now we will discuss little bit about pericardial effusion. So what is pericardial effusion? It is presence of abnormal amount of fluid in the pericardial space. And what is cardiac tamponade? That is acute heart failure due to the compression of heart by a large or rapidly developing effusion. And there are so many conditions that can cause pericardial effusion, like pericarditis, some neoplastic condition, uremia, hypothyroidism, connective tissue disorder, post-operative conditions, and also you will get pericardial effusion in mixed edema, severe pulmonary hypertension, in trauma, and in some autoimmune conditions like SLE, RA, and also it is caused by some drugs. So now we will discuss about clinical feature of pericardial effusion. Patient can be present with chest pain, syncope, palpitations, and shortness of breath. And in cardiac tamponade, we have triad, that is Beck triad. In Beck triad, we will get hypotension, muffled heart sounds, and raised jugular venous pressure. And in chest X-ray, we will get water bottle configuration, and in ECG, we will get low voltage QRS complex and electrical alternance. And on the basis of amount of fluid, we have divided into three categories, that is small pericardial effusion, medium pericardial effusion, and large pericardial effusion. If fluid is less than 1 centimeter, then that is small. If it is between 1 to 2 centimeter, that is medium, and more than 2 centimeter, that is large pericardial effusion. So how will you manage this condition? First, we have to give O2 support, then we have to do fluid resuscitation, and then pericardiocentesis. So in pericardiocentesis, we have diagnostic pericardiocentesis and therapeutic pericardiocentesis. So thank you so much guys for watching this video. In upcoming session, we will discuss some another abnormal finding of 2D echocardiography. तब तक के लिए bye bye, tata, have a nice day.